now we are going to look at good pasture syndrome and its clinical features. This is very important topic in uh, context of many high yield questions and exams like good pasture syndrome. There is involvement of kidney and lungs. In kidneys, what happens? Good pasture syndrome patient will have hematuria, burning maturation, proteinuria, protein leak in urine, oliguria, decreased urine output, and uremia. There will be uric acid increased and increased uremia concentration. And lungs, there will be inflammation, hemorrhage, hemoptysis, and dyspnea, difficulty in breathing, dyspnea. So uh, hematuria and dyspnea with inflammation and breathing. Okay, so anti-glomerular basement membrane syndrome or good pasture syndrome when there is necrotizing crescentic glomerulonephritis and a lining of IgG deposit with histological findings like this. And then and lung involvement like inflammation of alveoli pleuritis is also present there. So these are some very important findings of good pasture syndrome that are clinically very important. In good pasture syndrome, there's group of conditions like uh, kidneys and lungs and glomerulonephritis, like lung involvement, immune system problem, and okay, as we already mentioned that there is hematuria, urine blood inflammation, and hemoptysis is also there. Okay, so in this picture we can look at alveoli and its inflammation, like how inflammation alveoli uh, contributes in good pasture syndrome. Alveolar hemorrhage is there. As you can see, there are type 2 pneumocytes that make a surfactant, and then there is bleeding and seepage of blood. Basement membrane damage results into antigen presenting cells, T and B cells activation, and then anti-basement membranes are involved in this condition. So in this way, in good pasture syndrome, there is immune disorder that affects lungs and kidneys. In lungs, there will be pleuritis and inflammation of alveoli. In kidneys, there will be hematuria, proteinuria, and uremia. Uremia is also present. In good pasture syndrome, there is anti-GB glomerular basement membrane antibodies are found that results into hematuria and proteinuria. And then what happens? uh, cause clinical features are like trigger smoking, viral respiratory infection, hydrocarbon gasoline exposure, and HLA-DR15 is also contributing factor in good pasture syndrome. Then what happens in good pasture syndrome? Clinical features like hemoptysis, blood streak, sputum will be there, cough, shortness of breath, chest pain, renal symptoms, hematuria, proteinuria, hypertension, and edema is also present. These are very important features of good pasture syndrome. In laboratory investigations, what investigations we will perform? CBC, proteinuria, elevated C-reactive protein, chest X-ray, like to find out alveolar inflammation, and there will be a biopsy reveals IgG deposits in glomerular basement membrane. Treatments is corticosteroids, immunosuppression are needed like corticosteroids, prednisolone, cyclophosphamide, and supportive care is there. So in this way, we can treat the condition like post-streptococcal glomerulonephritis and good pasture syndrome.